Hello, this is Dr. Anna Maria Mihalta. I'm the president of AM Medical LLC in Yelm, Washington. Today I'm speaking about prevention and treatment of cognitive impairment and dementia with comprehensive integrative approaches. Let me tell you a little bit about my background. I'm a board-certified internal medicine physician. And I have worked in the last 10 years in the field of geriatrics. I was the medical director for the Geriatric Center of Excellence at Providence Health System in Lacey, as well as the medical director for the Panorama Nursing Facility for several years, which is a premier nursing facility in Washington State. During that history, I have seen tremendous suffering with the aging of cognitive faculties and the beginning of dementia, as well as late-stage dementia in nursing facilities. It was almost always my wish to be able to do something other than just continue prescription medications, but to proactively engage brain health. So with this history and this experience, what I'm about to talk about today is a very different approach. There are things that absolutely can be done to treat cognitive impairment and dementia, but it's also very important to even prevent the onset of it. So how important is preventative brain health? If you think about that, more than 16 million people are living with cognitive impairment, and at least 5.7 million people live with age-related dementias, in particular Alzheimer's. Many people in their 40s and 50s are already reporting symptoms of brain fog and decrease of mental acuity. That can have many different causes. But if we're not aware of what is causing and contributing to later life dementias, in an age where we can really work on extending lifespan, we want to focus on quality of life, and having our cognitive function intact is absolutely imperative for that. So addressing brain health preventatively should be a routine standard of care. I make it absolutely routine standard of care in my practice. I recommend assessments of brain function on an annual basis, just as I would have you do your annual physical. Risk factors and prevention of Alzheimer's, as well as other dementias. If you think about that, recognized risk factors are obesity in middle age, the lack of exercise. I just thought that 1 out of 5 Alzheimer cases are linked to the lack of exercise. Depression, chronic depression in life is associated with a much higher incidence of cognitive decline. High blood pressure at midlife. This is through the mechanism of the microvascular ischemic disease that can occur, that the little blood vessels are affected in the brain, and you can actually get a head CT scan of a 50-year-old or a 60-year-old who has had high blood pressure for some time, and you can see these changes that eventually will lead to dementia of a vascular cause. Low education and smoking are also risk factors. How do we prevent the onset of dementia like Alzheimer's? Well, improving the diet is important. The Mediterranean diet appears to have some protective effect. We'll talk later about that. To maintain a healthy weight, reduce the risk of diabetes. The reason for that is that diabetes is really called the type 3 Alzheimer's now. The glycosylation end product, which means that these deposits that occur in the blood vessels in the kidneys and in the brain when the blood sugars are elevated are a major engine for creation of cognitive dysfunction. Cardiovascular disease also has substantial risk in there, just like the high blood pressure. So to prevent cardiovascular disease is important. Exercise is an important key to prevent neurodegeneration. We have to treat and address depression and reduce stress. This WAVI brain technology that we have in our office is a fantastic tool, and it really allows me to access early diagnosis. I perform the brain WAVI test in the office, even in young people who want to know how to cognitively enhance them. We have younger people in their 30s who come in with brain fog and already cognitive decline, which may have metabolic reasons. We have younger people who have a history of drug abuse and drug addiction, which we know has detrimental effects to the brain. But then also the older generation who are noticing the onset of memory loss and inability to remember names or events, and it's a fantastic diagnostic tool. It's simple, it's fast, it's objective, and it's FDA-approved brain scan. And it measures the state of a patient's brain physiology, like brain speed, the voltage, the reaction time, with an EEG, an electroencephalogram. This incorporates these measures alongside with cognitive and behavioral test results. And so now with the WAVI, the brain health can be monitored, just like you come to the doctor and you have your blood pressure monitored and get your weight checked and your heart rate looked at. We are now able to monitor our brain health. And that picture is my wonderful tech, Sue-Ann, and Mary is getting her WAVI done. So the WAVI testing can give that information, like the trail making test is a neuropsychological test that provides information on the mental flexibility and executive function. It can give information about cognitive decline. We're looking at memory, connectivity between the hemisphere, front and back. And then we can monitor the interventions, because the brain actually changes. When we treat people, we see that there's different areas of the brain who now have improved activity. And these other markers are also improving. Definitely in concussion, the WAVI is also very useful because the brain changes after a traumatic concussion. Then we also check for attention, so we can get some indications if people have maybe attention deficit disorder. And then how is anxiety or depression affecting the brain? That is also available in regards to the information that the WAVI gives. So then from that, I am able to know how to address the different areas of the brain that need help. This is a sample WAVI report. So the P300, which looks at memory and attention number, is a great number that gives an overview of possible cognitive decline and in regards to the reference range of people's age. The voltage is very important. If you think about your cell phone, and if you're endeavoring to have communication in your cell phone, but your receptivity bars, instead of having 5 bars reception, you only have half a bar, then it could be that the information comes out crackly or incomplete. And similar with the voltage. We look at physical reaction time. We're able to look at actual brain age, which is not on this particular report. The trail making tests are giving information about executive function and whether or not someone has decline in that area of brain function. Then we have the information regarding attention deficit and depression. So this is one of the sample reports. And the wonderful thing is that when we do an intervention and we treat people, we can, for example, reverse brain age by a couple decades. We can increase voltage. We can improve the P300 values. So the brain is very susceptible to interventions and improvements. So treatment approaches to cognitive decline, yes, they do include the self-responsibility of lifestyle changes, including exercise, and particularly walking. Walking is very important because neurogenesis is activated during walking. Sleep improvement is important. We have to optimize the nutritional status. So if there is the desire to rebuild cellular function and optimize it, then it is as if the cell is a house. Let's say your house is really run down and it's not working properly and it's getting old, and if you want to rebuild it and you want a fully functioning brand new house that's acting in a younger way, then you have to give it the windows, the bricks, the wallpaper, the doors, the doorknobs, all of the different aspects of the house have to be addressed. And if for example, one part of the foundation isn't working right, then the whole house can have a problem. Well, it's similar with your cells, actually. So if we're endeavoring to allow the cell to regenerate itself, we have to address these nutritional deficiencies. We want to downregulate inflammation. We may do this with oral supplementation or with IV nutritional therapy. The other thing that we want to do, there's been a very strong correlation between heavy metal total body burden and cognitive decline, as well as vascular arteriosclerosis that can then also lead to vascular dementias. So where indicated and where people do have documented a high body burdens or high blood burdens in terms of these heavy metals, we would pursue heavy metal detoxification like chelation. Phosphatidylserine, phosphatidylcholine. So this is the group of your phospholipids that your neurons need in order to rebuild themselves. Magnesium L-threonate has been shown to be very beneficial for neuronal health, has been associated with improved learning, working, short and long-term memory improvements. I work a lot with neurotropics. Neurotropics are nutraceutical natural substances that are augmenting and accelerating neuronal health and regeneration. Then I work with neurocognitive peptides, and in the peptide realm we have some wonderful possibilities like C-Lang, C-Max, cibrallicin, dihexa, even DSIP, so I will speak more about that. There are other ways of addressing neuronal health. Hydrosolized or nanoparticulate gold binds to voltage-gated sodium channels, which modulates nerve regeneration and electrical activity. So there are supplements in that arena. For example, when people have really low voltage, there are different ways of increasing cellular voltage. Exosomes have profound effects for brain health. For people who don't know about exosomes, I would ask you to check out my videos on my YouTube channel. about exosomes and the treatment that can be utilized by using exosomes. But in the exosomes are microRNA that support neuron regeneration in profound ways. So I definitely think that that's fantastic possibilities. Hyperbaric oxygen therapy absolutely has been shown to promote neurogenesis. This is utilized in stroke rehabilitation, can be utilized for any sorts of cognitive impairment and dementia. And with ongoing treatment, there have been some documented profound effects, and we'll discuss those as well. So the exercise benefits, it improves your heart health. So when you have a healthy heart, that's actually correlated with brain health. We have another test in our office called the autonomic nervous system test. And when you get information about microvascular changes, about arterial stiffness, about inflammation, lack of nitric oxide, all of those are affecting the nutrient deliveries also to the brain. So we want to maximize and optimize the health of the vascular system because that directly correlates with brain health. Exercise improves your muscle tones. It reduces inflammation. So inflammation is what accelerates also neurodegeneration and the aging process. Exercise induces brain neuroplasticity, so we want that. We still have stem cells in our hippocampus that are ready to make new connection at any point in life. Even if you're aging, it is not true that the brain isn't changing. The brain is extremely malleable. Exercise improves cognitive performance, it protects against age-related decline, and it increases the volume of the hippocampus, which is the memory center, but this is also where your stem cells are, so that's important to know. There's also correlation with increases in volume of the prefrontal cortex, so that's where we have our spatial memory and our decision making, which is often impaired in the onset of dementia. You have a boosting of the neural signaling across critical brain networks. The brain is like a supercomputer, and the different areas have to talk to each other to be able to facilitate a cohesive cognitive function. Exercise increases the brain fertilizer, BDNF. It strengthens the synaptic connections and helps create new ones. So the synapses of a neurons are like its fingers and the little points that are talking to each other. And it's very important that all of that is healthy. Mood improvement is very important. We saw earlier that depression is associated with cognitive decline, and telomere lengthening is good for every cell in your body. That means that they're younger and healthier. There have been studies that indicate that diet may help prevent Alzheimer's. For example, the MIND diet, which is a hybrid of the Mediterranean and the DASH diet. And they have been found to reduce the risk of cardiovascular conditions like high blood pressure, heart attack, and stroke. The MIND diet is rich in vegetables, berries, whole grains, and nuts. And there was a study in which 923 patients aged 58 to 98 were studied over an average period of 4.5 years. And the MIND diet lowered the risk of Alzheimer's by as much as 53% in the participant who really adhered to this diet rigorously, and about 35% who followed it moderately well. And here's again these ingredients that are in the MIND diet: green leafy vegetables, nuts, berries, beans, whole grains, fish, poultry, olive oil, and wine in moderation. So the reversal of dementia is possible, and that's been absolutely studied. So this was an article that showed that scientists reverse memory loss for the first time in Alzheimer's patients with changes to sleep, diet, medication, and exercise. There was a study of 10 patients, found that they had memory improvement. They've been able to return to their jobs or continue working. And this is to suggest that memory loss in patients can be reversed and that the improvement is sustained. So there was a therapeutic treatment program that combined comprehensive diet changes, brain stimulation, exercise, sleep optimization, specific drugs and vitamins, and other steps that are affecting brain chemistry. And this came out of the Buck Institute in collaboration with UCLA. So what did they do? They eliminated simple carbohydrates. So as you know, simple carbohydrates, particularly things like sugar, they increase inflammation in the body. They eliminated gluten, processed food with preservatives, which have no substantial nutritional value. So these were eliminated from the diet. They were eating more vegetables, fruits, and non-farmed fish. They were meditating. They were addressing their spiritual well-being, and they were doing yoga to reduce stress. They improved their sleeping to 7 to 8 hours per night from about 4 to 5. They were taking melatonin for that. Melatonin is a fantastic antioxidant that has profound protective effects for the brain. B12 is utilized by the nerve sheath of neuron. Vitamin D3 is extraordinarily important for the brain health, and 80% of Americans are deficient in it, with the optimal levels being greater than 75 in the blood. And in some patients, that means taking 10, even 20,000 units of vitamin D3 with vitamin K on a daily basis, because the absorption can be being impaired. Fish oil I'm a bit cautious about, mainly because of the mercury exposure that gets and heavy metals. Fish oils are stored for a prolonged period of times and then can get rancid as well. So I mainly work with plant-based omega-3 and omega-6 in the ratio of 41. Coenzyme Q10 is important for the mitochondria, the powerhouse of the cell. Statin drugs deplete the body of coenzyme Q10, and so it's very, very important to either get off the drug or to use CoQ10 on a daily basis to protect oneself. Optimizing oral hygiene using an electric flosser and electric toothbrush. Reinstating hormone replacement therapy, which has been previously discontinued on the WAVI test, because different hormones have profound effects on brain. You can see improvements with, I use mainly bioidentical hormone replacement where indicated. And then fasting, intermittent fasting, has been shown to prolong life, to be major anti-aging intervention. So they were doing this between dinner and breakfast. And they were exercising for a minimum of 30 minutes, 4 to 6 days per week. So this shows clearly that it is possible to reverse these dementias. In regards to the peptides that can be utilized, there are numerous ones. There's some very famous ones like dihexa, but C-Lank is one of my favoriteest peptides. I call it the thank you God peptide. The amount of people who've had beneficial effects just from the stress relief that this peptide provides. So a peptide is a short-chain amino acid. It is like a key that acts like a key for a lock. It doesn't have any side effects. It dissolves anxiety. And why is it so important to address anxiety and emotions when we're endeavoring to work with neurotropics, which are engaging the growth of new neural nets? It's because we don't want the anxiety and the depression to interfere with the new connections. So usually when somebody has had a lot of stress, we start with the C-link because you want to inhibit these reactions to allow the brain to regenerate in a different direction. So it's an anxiolytic without side effects. It treats general anxiety, fear, tension, but it also boosts focus, enhances concentration, improves memory and learning. It improves mood and gives a sensation of well-being. People have increased brain energy. Anhedonia is something that occurs, the lack of motivation, so it appears to have effects in reversing that. It's a neuroimmune modulator, so in many people when they have chronic inflammatory diseases, leaky gut, or they've used drugs before, they can have neuroinflammation, and that neuroinflammation manifests itself with low voltage in the brain. So when we're able to address that, something like C-link, people see improvements very rapidly. I've never seen a single side effect with C-link. It really is a fantastic peptide. One of the wonder drugs of neurology is dihexa. I use dihexa a lot in this Science News Review. So at Washington State University, this was developed, and it improves cognitive function with Alzheimer's, like mental impairment in rats, and it was intended to repair brain damage. And it may slow the process of cell death or inhibit cholinesterase. So these were the current treatments of Alzheimer's treatment work like that. And the dihexa has been shown to be one of the prime synaptogens. It kind of makes a neuron grow like a tree. So the gold standard compound for creating neuronal connection is the brain-derived neurotrophic factor BDNF, which is a growth-promoting protein associated with normal brain development and learning. And so in Alzheimer's patients, they have low levels of BDNF in the brain. So Dr. Harding and Dr. Wright and their colleagues found dihexa to be 7 orders of magnitude more powerful than BDNF, which has yet to be effectively developed for therapeutic use. In other words, it would take 10 million times as much BDNF to get as much synapse formation as dihexa. I mean, that's just amazing. So Dr. Harding was quoted here saying, we quickly found out that this molecule was absolutely insanely active. So we're really fortunate because we can get dihexa through our compounding pharmacy. As I mentioned, I've used it a lot. I think that the response are very rapid in the majority of patients. I've had patients who said taking dihexa is like somebody turns on a light bulb upstairs. So I think that this is an absolutely wonderful possibility for treatment of cognitive dysfunction and dementia. CMAX, I also use this. This is another peptide that was developed in Russia, just like C-Lang. It's used for neuroregeneration. It provokes enhanced learning, accelerated nerve regeneration, improved neuromuscular performance. It regulates attention and memory formation. It's used for Alzheimer's, stroke, attention deficit, nerve regeneration, ALS, Parkinson's, memory improvement. So I've used CMAX and dihexa as well as C-Lank in Alzheimer's, in other vascular dementias, in Parkinson's. Sometimes doing a rotating combination therapy or staying with one peptide for a period of time, then switching to another is really helpful. So there's definitely possibilities, and they can be tailored individually to the patient's need. I really like deep delta sleep-inducing peptide because one of the things that happens is that when people don't sleep well or they have sleep-wake dysregulation, so with cognitive impairment, people are up all night and then, that they can't sleep, and sometimes they sleep during the day, and then DSIP is a neuromodulator. It's found in the brain naturally, and it's been used to treat sleep disorders, depression, pain. It has some wonderful effects in terms of changing pain sensation in the brain or perception. It's used in alcohol and opioid withdrawals and chronic stress, and it has pronounced stress protective action. It also has muscle building effects, which in particularly older, frail patients is useful. But it's been shown to improve blood supply to the brain during stroke and chemotherapy. Many have heard the toxic side effects of chemotherapy what's called the chemo brain, and the DSIP has been helpful for that. So it encourages brain healing and reduces metabolic brain damage. So I wanted to mention that as well. Sometimes I use DSIP with epithalon just to help people start to feel better. There's definitely options with these wonderful peptides. Chelation therapy, I'm a huge proponent of. If you think about that, if you have a very high total body burden of heavy metals that are interfering with your DNA, they're causing decrease in nitric oxide in your body, they're increasing inflammation, they're accelerating your aging process, they cause hormonal disruption. So chelation therapy may ease Alzheimer's dementia and its progression because, and specifically in Alzheimer's, there is a deposition of abnormal proteins in the brain, beta amyloid, and it appears that chelation therapy found that it lowered these levels of the protein beta amyloid with moderate to severe forms of Alzheimer's disease. I use chelation therapy a lot, and I use it for cognitive impairment as well, particularly when we find the documented high total body burden of heavy metals, and I find it very useful. It's not an overnight improvement. It takes time to get these heavy metals out of the system, but I think it is an important cornerstone of treatment for anybody who wants to restore their health. Exosomes have been shown to be also helpful in removing these beta amyloids and tau proteins and thereby improving things like Alzheimer's disease. So if you haven't seen it yet, check out the exosome video, and I give more information about the amazing microRNA that is available in exosomes that can regenerate neuronal health, and how exosomes are very intelligent and know exactly where to go in the body. So I think that this is a fantastic potential treatment. Hyperbaric oxygen therapy promotes neurogenesis. It's been shown to decrease infarct size and strokes, promotes neuronal stem cell differentiation into neurons. In traumatic brain injury, it's been used beneficially. In autistic children, it's been used beneficially. So there are studies for nursing home patients who needed maximum assistance. They underwent 2 to 3 times hyperbaric treatment for several weeks and were able to get back to independent living. The brain responds extremely well to this treatment. If you would like further information, please check out our website, ammedicalmd.com. Also, check out my YouTube channel that has many videos on different health conditions and treatments, and follow us on Facebook. Thanks so much for watching.